Hi, thank you for tuning in. If you are watching this video, you were either scheduled for surgery or you're in your recovery period. We're going to talk about recommendations for your recovery, normal findings in your postoperative period, and then the timeline for your recovery. During your first 2 weeks after your surgery, we really want you to limit your activity. We want you to be down for 2 hours, up for only 5 minutes to help decrease your swelling and control your pain. You'll be given a polar pack, also known as an ice machine, after your surgery. Buy 12 water bottles, your regular sized water bottles. Freeze them all. 6 water bottles will fit in your ice machine. As your water bottles de-thaw, exchange your water bottles for your frozen water bottles. Put that ice machine on your knee and use it as much as possible. Although very rare, your ice machine can result with frostbite, so we make sure you check your knee every 2 hours and use a barrier between your ice machine and your skin. If your skin gets too cold, remove your ice machine and allow your skin to come back to normal temperature. Now let's talk about your normal postoperative findings. You may note that your knee can be red, it will have some swelling, and it might look a little angry, and it might be warm to the touch. You might note that you have some nerve pain, and it can be difficult to lift your leg after surgery. You can also experience some difficulty sleeping, and you might have some thigh pain. You are able to use some moist heat only on that thigh to help alleviate your thigh pain. You will start your physical therapy 6 days after surgery. You'll go 3 times a week, up to 6 weeks. We do not want you strengthening. That means any active straightening your leg, bending your knee. Anytime you use your brain to straighten or bend, you are actively strengthening your muscles. We love passive range of motion and modalities. Don't worry, your strength will increase as your activities increase. Now let's talk about your extension. Dr. Kristensen will get you 100% fully straight during your surgery. Our number one goal is to maintain that extension. One way to tell if you are fully extended is to bridge both of your legs and compare your knees, and you can see which one is straight. While you were down for 2 hours, what I want you to do is I want you to lightly push down on your thigh to help get that extension. You will feel some tenderness and some pulling in the back of your leg. That is normal. Once you're feeling a little bit of pain, relieve, and I want you to do that intermittently while you're down for 2 hours. Next, let's talk about your flexion. Your flexion will come with time and work. There are 3 ways that you can work on your flexion. The first one is to put your non-operative leg over your operative leg and pull back until you feel a stretch. Hold that for 5 seconds and then release. Do this intermittently throughout your day. Next, you can sit on your bottom. You can grab your operative leg behind and roll back to your back. Stick that operative leg up and then use your non-operative leg to support your operative leg. Let your operative leg go down with gravity with the support of your non-operative leg. Let that stretch for 5 to 10 seconds and then push up with your non-operative leg. If you are unable to get into that position where you're holding behind your leg, go ahead and position yourself up next to a wall. Place your operative leg on the wall and then position your non-operative leg underneath your operative leg. Slowly let your operative leg go down with gravity until you feel a stretch. Hold that for 5 to 10 seconds and then release by pushing up with your non-operative leg. Now during your first 2 weeks, we really want you to limit your activity, use your polar pack, and really work on your extension and your flexion. Between your 2 to 6 week mark, our goal is for you to achieve a range of motion of 0 to 120. Now remember, every patient is different, so your flexion can range 10 degrees on either side. Everyone is unique and we all have a different recovery journey. Continue to ice as needed. Use moist heat prior to activity and ice after your activity. You can begin to use a recumbent bike after 2 weeks. Move your seat closer to work on your flexion and move your seat farther back to work on your extension. We'd like you to gradually increase your usage either by the minutes or the amount of time used per day. For example, you can use your recumbent bike 4 to 5 times a day for about 5 to 10 minutes, or you can go twice a day for 20 to 25 minutes. Add on more time if it's easy, and subtract more time if you're too sore or painful. Now remember, your total knee recovery can last from 6 weeks up until 6 months. After your 6-week mark, we want you to increase your activities and your recreational activities if your range of motion is maintained. You may see an increase in swelling. This should dissipate within 1 to 3 days. Continue to ice if your knee is swollen and use moist heat prior to activities or if your knee is stiff. Once you have obtained your range of motion and you're able to perform your range of motion with ease, you may start strengthening, and usually this is within the first 6 months. Now, strengthening is optional and not necessary, but this is based on the individual. Thank you for tuning in. We are the Dr. Kristensen Dream Team, and we are available throughout your entire recovery. Please never hesitate to call. We are more than happy to guide you through your journey.